The Ranchos Amigos scale, also known as Ranchos scale, is an assessment that was developed by the Ranchos Amigos Hospital's head injury team in order to gauge the cognitive functioning of their patients who just woke up from a coma. It's a good tool for healthcare professionals to gauge how a patient is doing as they undergo the process of recovery from a head injury or traumatic brain injury that caused them to slip into a coma. The scale is composed of 8 levels of cognitive functioning. These levels describe the stages of recovery that a patient goes through after getting treated for a TBI and/or awakening from a coma. Since the scale was designed to assess patients who have sustained head injuries or traumatic brain injuries, any healthcare professional who specializes in treating neurological disorders, cognitive and behavioral issues, and certain physical disabilities can definitely include this in their roster of tools. Medical professionals who will find this scale useful are neurologists, psychologists, and psychiatrists. To use our free Ranchos scale, follow these steps. Download our Ranchos scale from the Carepatron platform, which you can find in the link in the description. Before one fills out a Ranchos scale, the healthcare professional who will use it must observe the patient. You can do so during an appointment you have with them, whether it takes place in your clinic or if you're conducting a house call. What you will be observing are the following: their arousal and awareness, their motor responsiveness, and their cognitive ability. In order to see how they are, what you can do is try to interact with them and see if they are able to open their eyes when they are nudged or talked to, or if they actually can just open their eyes spontaneously or not. If they are able to respond to your voice, you can check if they are oriented or disoriented, if they are able to converse or not, and if they are able to form coherent sentences or if they make incomprehensible sounds. You can also observe their mood and see if they are calm or irritable. You may also ask them to do things so that you can observe their motor responsiveness and see if they can carry out tasks or not. The task does not have to be complex. Once you have observed the patient, you can rate them with any one of the following. Level 1 is no response, Level 2 is generalized response, Level 3 is localized response, Level 4 is confused agitated response, Level 5 is confused and appropriate non-agitated response, Level 6 is confused appropriate response, Level 7 is automatic appropriate response, Level 8 is purposeful appropriate response. Here is a sample of our Ranchos scale, which you can find on our Carepatron platform. To find our Ranchos scale, go to our Carepatron platform or click on the link in the description. In our template section, we have a variety of templates and worksheets for you to use with your patients. You can filter or type in the keywords to find the worksheet. Thank you for watching our video at Carepatron. If you enjoyed this video, give us a like. If you would like to see more videos like these, subscribe to our Carepatron channel or click on one of our recommended videos.